Good afternoon, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Medical Officer of Health here in Peel, and Nancy McDonald-Duncan, our Acting Fire Chief and Director of Emergency Management. Before I give my COVID-19 update, I want to acknowledge that Peel Regional Police and the hard work that they do, day in and day out, to keep our community safe. Earlier today, Peel Police provided an update on Project Siphon, a multi-jurisdictional investigation into organized crime that largely focused on gang activity here in Peel. More than 80 arrests were made and more than 800 charges were laid right across the GTA. Investigations seized 34 firearms, nearly $1.4 million in cash, and more than $1.9 million worth of illegal street drugs. This is a huge win for our police and for our community. Above all else, it sends a strong message that organized crime simply won't be tolerated in Mississauga or tolerated in the region of Peel. I want to thank all of our Peel Regional Police officers for their hard work and Chief Nish for his strong leadership. You're truly setting a new bar for policing, not only in Canada, but right across the world. COVID-19 continues to grip our community, with an average of 399, almost 400, new daily COVID cases over the last week in Peel Region and 113 new daily cases in Mississauga. Mississauga is now averaging 113 cases per 100,000, with a positivity rate of 7.9%. Our region as a whole is leading the province in both of these categories, with 180 cases per 100,000 and a test positivity rate of 11.8% here in Peel. Our hospitals continue to see more and more COVID-19 cases. Trillium Health Partners is near capacity and is now dealing with more than 60 COVID hospitalizations, with 12 people in critical care and 42 more waiting for their test results. That's 114 rooms being used for just COVID patients. 14 staff members have also recently tested positive for COVID. I've been told that Trillium is preparing for even more cases. And while elective surgeries have not yet been cancelled, there is a growing concern that they soon will have to be. At William Osler in Brampton, the situation is even more dire. The hospital is currently in gridlock with more than 70 COVID hospitalizations. 10 patients are in ICU, and more than 40 are waiting for their test results. That's 120 rooms being used for just COVID patients. The hospitals began cancelling elective surgeries last week and transferring patients to other hospitals across the GTA and right across the province to make room for the surge in COVID cases. What deeply concerns me is the situation in our congregate living settings. We're seeing more and more spread in these settings, with 11 of our long-term care homes, 5 retirement homes, and 4 group homes, all in outbreak. Our Tyndall nursing home, with more than 90 residents and 60 staff, have recently tested COVID positive. This is the sobering reality of what we're seeing, what we're facing here in Peel and as a city. We continue to see widespread transmission in the community and are struggling to control the virus. In fact, the virus is controlling us right now. Private gatherings, both large and small, continue to drive our numbers. We're the ones moving this virus, giving it to our coworkers, our neighbors, our family members, and our friends. We're moving closer and closer to lockdown. I do want to take a moment to thank Mississauga's South Asian communities for safely celebrating Diwali and Bandi Chhor Divas over this past weekend. I know it was a big ask to celebrate with just your household this year, and I'm so grateful so many people listened and complied with the rules and with the recommendations. I'm hopeful that the measures we currently have in place will soon result in our case numbers going down. I realize that this is a fast-moving situation, and there has been confusion about what restrictions are currently in place in Mississauga. So I now want to take some time to go over our current picture. Peel Region remains in the red control zone. In addition to the restrictions in the red control zone, Dr. Lowe has added some further measures in Peel in an attempt to reduce community transmission. Some of these additional measures are enforceable by law, while others are strong recommendations. Let me walk through what this means for Mississauga. Restaurants, bars, and gyms are permitted to have a maximum of 10 people inside their establishments at any given time. The sale of liquor at any restaurant or bar is limited between the hours of 9 a.m. and 9 p.m., closures at 10 p.m. indoors. Indoor dining must be limited to 10 persons per table. Outdoor patio tents must have 2 open sides to allow for proper ventilation. Note that propane tanks used inside an enclosed tent is a safety hazard. Peel Public Health also strongly recommend that only members of the same immediate family sit together when dining inside. All cinemas, concert venues, theaters, and performing art facilities, with the exception of drive-in cinemas, must remain closed. Wedding receptions at any business establishment are prohibited until January 21st. Other types of social gatherings in business establishments, such as baby showers, anniversaries, retirement, and birthday parties, are highly discouraged for the time being. At all meeting and event places, including banquet halls, must remain closed. Personal care services, such as barbershops and hair salons, can remain open with limited capacity to the number of people who can remain safely a 2-meter distance apart from one another, and personal care providers must wear appropriate PPE, face coverings, and the removal of masks is strictly prohibited. Retail stores are permitted to be open. However, adjacent fitting rooms are not permitted, and business owners must ensure that their customers lining up outside are at least 2 meters apart and wearing face coverings. Religious places of worship are permitted to hold services with a 30% capacity. However, it is strongly recommended that they bring their services online and limit their capacity to a maximum of 150 people. I'm walking you through these additional restrictions to provide more clarity so that everyone understands exactly what is expected of them. And while you won't get ticketed for having a group of 10 people in your home or for 25 people in your backyard, my message to residents today is simple. Please limit to your close in-person contact to only those people in your immediate household and your essential supports. This is not the time for a coffee chat, a dinner party, or having your extended family over to visit. This is not that time to have a birthday party in your backyard. Please limit your activities to just the essentials: getting groceries, getting gas, working out when you need to, going to the pharmacy, doing your banking. I want to thank all our residents and our businesses, our faith-based groups who are following the guidelines. But everyone needs to do their part. If we don't, we're inevitably going to see more restrictions coming into effect. As the Premier said earlier today, we're staring down the barrel of a lockdown, which means more restrictions on business, more restrictions on places of worship, more restrictions on your everyday life. It's only by listening to the advice of our medical officers of health that we can get to the point where we can start talking about larger reopenings. Do this for your family, for your neighbors, for the small business owner. Do this for Mississauga. Our collective goal has to be keeping COVID out of our long-term care homes, keeping our schools open, and giving our small businesses a fighting chance to survive. The seriousness of the situation in Peel has led Dr. Lowe to enact the further measures over the weekend to limit the spread of COVID-19 in our workplaces. We have long known that the transmission of this virus is often starting in a workplace outbreak, which then leads to individuals spreading it to their household and to the wider community. There have been 116 workplace outbreaks since September, and there are currently 80 active investigations. Under a new order from Peel Public Health, owners of workplaces can now face a fine of $5,000 per day for failing to take the necessary action to prevent or stop the spread of COVID. This is not about penalizing workplaces, but rather ensuring that they're doing everything they can to limit the spread. The order requires all employers where someone has been diagnosed with COVID, has symptoms, or has been exposed to someone with the virus to immediately follow Peel Public Health and provincial guidelines. Businesses will not be fined if they follow these measures once they become aware of an outbreak. But this order, however, only goes so far. It cannot legislate businesses to provide sick pay for employees who become ill with the virus or who are waiting for their test results. On my call with the other GTHA mayors and chairs earlier this week, we talked about how a lack of sick pay benefits may be leading some workers to forgo testing for fear of losing their paychecks. I'm calling on all levels of government and all private sector leaders to come together to find a way to give workers confidence so that they won't be penalized for getting tested, getting sick, or self-isolating to stop the spread of COVID-19. I'm also calling on the Senate of Canada to immediately pass Bill C-9 to enact an act to amend the Income Tax Act. This includes new Canada Emergency Rent Subsidy and the extension of our Canada Emergency Wage Subsidy. Our businesses need this help now more than ever. Stalling will only further hurt our businesses, especially our small businesses. I know that many of our small businesses simply want to see themselves reopened. Again, I am truly sorry that many of you are struggling right now, struggling to pay your employees, to pay off business expenses, and to put food on your own tables. I will continue to advocate on your benefit, just as I have since the outset of the pandemic. And while I know that some of you may be look at business supports as cold comfort, I'm urging all of you to please take advantage of them. Please apply for the provincial property tax and energy rebates that become available this Monday. Apply also for the $1,000 one-time grant from the province to increase your PPE stock. At the City, we have extended our partnership with Ritual One so that any Mississauga business can access their digital ordering platform free of charge until the end of the year. You can also take part in our free online marketplace called #MississaugaMade that's open to all Mississauga-based businesses. We're providing free one-on-one business consultation through the Mississauga Business Enterprise Centre. And businesses can apply for our digital transformation grant at $2,500 that can help you as you shift more and more to get your business active online. Last week, the City also extended its outdoor temporary patio program until the end of 2021. And this week at General Committee, staff were directed to prepare a temporary use bylaw to permit outdoor retail sales, recreation, and entertainment. I'm again calling on all residents to support Mississauga businesses. Order in dinner from one of our incredible restaurants on Takeout Tuesday, or deliver wine with your dinner on Wednesday evenings. Buy your Christmas gifts from one of our amazing local retailers or one of our specialty retail shops. I'm doing everything in my power at the City to support our small businesses, but the reality is, for us to start loosening restrictions, people must start to dramatically change their behavior. We have to do this for our businesses, but we have to do it for the elderly in our long-term care facilities and in our seniors' homes and those people with underlying health conditions, and for our hospitals to ensure that we don't run out of space or out of critical care beds, or for our children so that they can remain in school. I know we can do this, Mississauga. As I've been saying week after week, please limit your close in-person contact and limit your outings to just the necessities. And as always, please take precautions. Let's pull together right here, right now, and get the spread of this virus under control. And now I invite Dr. Williams to come up to the podium and provide us with his weekly update. Thank you.
Thank you, Madam Mayor. Good afternoon. Dr. Lawrence Lowe with Peel Public Health. As of noon today, Peel Public Health has investigated 7,152 cases of COVID-19 in Mississauga, and of these, 748 are active, 6,163 have recovered, and 241 have passed away. This week, COVID-19 once again breached the strict protections around our most vulnerable, and we have seen one of our largest outbreaks in a long-term care facility since the first wave at Tyndall Senior Village here in Mississauga. 90 residents and 65 staff have tested positive, and while our integrated response team is working tirelessly with the home to address infection control and outbreak interventions to bring this under control, this is a dangerous sign. More cases and outbreaks in long-term care, in schools, and even hospitals, our area hospitals that are navigating a surge of COVID hospitalizations, together with the implementation of a streamlined contact tracing process to reach new cases quickly as caseloads grow day by day. This means our best line of defense remains the same. To keep ourselves, our loved ones, and our community safe, we must stop transmission in the first instance. And to do that, we must limit our in-person interactions. Please reduce your interactions to stop outbreaks and clusters in our places of worship, hospitals, long-term care homes, and schools. Reduce interactions to reduce cases, hospitalizations, intensive care stays, and in the worst instances, deaths. Now, more than ever, we must recommit to the goal of reducing our in-person contact. I know it's been a long year, and I am also tired, and I want you to know that I don't enjoy standing here week in and week out saying the exact same thing. But we need to stay focused on our goal, less in-person contact. If we do not meet, COVID-19 cannot spread. So for the next 2 to 4 weeks, I continue to ask all residents in the region of Peel to stay home unless you have an essential reason to be out, whether it's for work, school, accessing healthcare, purchasing necessities, or outdoor exercise. Otherwise, restrict all close contact to within 2 meters to the people that you live with, and adhere to precautions of distancing, masking, and hand washing with anyone outside your home. Do not attend or hold social gatherings. Postpone or take it online. Thank you for taking these measures to heart and for taking action now. I remain hopeful that we may be able to avert broader closures, which might be needed to reduce interactions beyond the home and prevent access to high-risk settings. But our window is getting thin. Your personal actions matter more than ever. And as the balance tips towards controlling COVID, we will need to act early and decisively to bring things under control so that we can reopen the community with confidence. Hence, until a vaccine arrives and is widely available, your best weapons against this virus are still the same. Less in-person contact, and please pack a healthy dose of patience. Besides continuing to streamline and trace contacts, Peel Public Health is also trying to create contexts for your success in this endeavor by instructing that large social gatherings and celebrations stop or go online, and by directing workplaces to take steps to protect their workers, and also by recommending remote work whenever possible. We also need better protections for those who are most vulnerable and disproportionately impacted. We need paid sick leave and worker protections for employees that fall sick, and also assistance for proprietors impacted by restrictions and closures. This support and relief will help those that are most impacted in our community and ensures that we are all truly in this together. It also means that while recent announcements about vaccines might give us hope, we need to stand strong together and keep each other safe, pushing towards our goal of less in-person interactions until that later time comes. Each of us is an important piece of the puzzle to controlling COVID-19, so I thank you for doing your part, and I will pass it back to Mayor Crombie.
Thank you, Dr. Lowe. I think I promoted you earlier. And now we're ready to take questions from the media.
Madam Mayor, your first question comes from Ashley Newport at Mississauga.
Welcome, Ashley.
Hi, how are you?
Oh, I'm good. I'm worried. How about you?
Same. Same. So, speaking of worry, I wanted to ask you about the province's announcement earlier today, because it seemed like Premier Ford implied that on Friday we're going to get some news, probably not good news, and he seemed to say that at least Peel and Toronto and York Region will be facing some sort of increase in restriction. Whether or not that'll be a full lockdown, he didn't say. How concerned are you about this, and do you know what people should maybe be expecting or preparing for on Friday?
So I can't anticipate what the decision or the outcome will be. I know that there are discussions among the public officers of health, and I'll ask Dr. Lawrence Lowe, our medical officer of health, to come up and speak to that. But when you have the positivity rates we have, 11.8% in Peel, the R factor that we have, which is over 1.2, and the cases per 100,000 in Peel are 180 per 100,000. It's pretty significant. I think at this point we all have to do everything we can to reduce the spread of the virus. I tried to give you a picture of what our hospitals look like, and certainly a number of hospital rooms are being used just to isolate COVID patients. So it's quite dire. I don't want to underestimate that, and that's why I said that I am concerned. And I will now invite Dr. Lawrence Lowe for further comment. Thank you.
Thank you, Madam Mayor. Thank you, Ashley, for the question. So, certainly we continue in discussions with the province around the situation here in the region of Peel. And I think I have previously stated my support that if conditions warrant, certainly some form of additional measures would be needed to ensure that we can reduce in-person interactions. At this point in time, certainly we are going forward with the instructions that I provided in my letter of instruction from November 7th, and also in the Section 22 that was issued this past weekend to workplaces, with a goal to really tackle in that triad social, workplaces, and of course in household contact with the voluntary isolation center coming online. So at a local level, we have tried significantly to take as many steps as we can to encourage people and to drive home the necessity of really at this time staying home as much as possible, interacting only in close contact with those that you live with, and then limiting any interactions outside your home to the most essential reasons with precautions. At some point, and especially where our numbers are at right now, the conversation must turn to, firstly, additional measures, closures and curtailments that may be needed to reduce the immediate short-term issue. But we also need to continue talking about the other measures that we need to take in place. One of our biggest challenges in workplaces is that many essential workers would still be working even if broader community containment measures are used to bring this under control. So there is definitely a need for us to continue to consider those broader community containment measures to bring things under control, but in terms of also addressing and dealing with some of the root causes of transmission amongst essential workplaces and their households in our community, we also need to look at some of those other measures around paid sick leave, worker protections, rent supports that I've previously mentioned, because those also play a part in incentivizing the right behavior, people to self-isolate, stay safe, and keep their community safe as well. Thanks so much, Ashley, for the question.
Follow-up?
Oh, yes, and actually my follow-up is for Dr. Lowe as well.
I'm back.
You got that. Actually, I wanted to get your thoughts on something. Over the weekend, a group of doctors from Ontario launched a social media campaign that they called COVID Zero, which calls on all levels of government to commit to stamping out COVID entirely through an aggressive test, trace, isolate program, but also potentially radical restrictions on movement for several weeks or even months. These doctors are using Slovakia and Australia as examples that we can follow, but we know that part of Australia was locked down. I think it was well over 100 days And that lockdown was a lot more severe than the one Ontario imposed even in March. So you mentioned that workplace outbreaks are such a huge problem. So I'm actually wondering your thoughts on this. Is COVID zero attainable, and would it work in a place like Peel where so much transmission is linked to essential work? Just, I guess, what are your thoughts on that campaign?
Well, so as you identified, certainly there is both essential work that is driving our transmission in Peel, as well as a lot of other discretionary activities that are all continuing to happen. And there's obviously, intermixing between those networks in terms of where transmission may be occurring. So certainly, I think, and I actually know many of the physicians who are advocating for the COVID zero campaign. My view has always been that we are essentially threading a needle through the very extreme impacts of uncontrolled viral spread of COVID, with the very real impacts of certain measures that are being taken, and there is certainly, to be sure, a lot of health impacts and harms on both sides. So I think it's all part of a continuing conversation. Either way, the most important thing that we need to do in the region of Peel right now, whether the goal is zero or less, is basically we need to take our restrictions seriously and get this under control. So it's certainly part of an ongoing discussion, and I imagine many of the measures and restrictions that are identified by my colleagues and friends who are advocating for COVID zero would be really for our decision makers to think through as to how that would look in our context should it be pursued. Thanks very much for the question, Ashley.
Next question comes from Isaac Callan at the Pointer. Go ahead.
Isaac, before you ask your question, can I just respond to Ashley as well? And Ashley, I feel very strongly that whatever is done should be done region-wide. I mean, right across the GTA. It would be very difficult to go into lockdown. I think in Australia, Melbourne, they did it for a 6-week period, and then there was a stricter confinement for a 2-week period, I believe. But it has to be done region-wide, otherwise people will move, and there'll be that spillover effect. People will move from one region to another for those services, etc. Isaac, welcome.
Hey, Mayor Crombie. I'd like to ask a little bit about your council's attitude to COVID-19, actually. So over the past few weeks, we've seen the cases get worse. We've heard you and Dr. Lowe get more and more serious. But sort of in parallel, I'm not sure council's necessarily doing the same verbally. Last week, Councillor Dasker was talking about how contact tracing could be used to reopen restaurants, even though Peel Public Health has had to streamline it. We also had Councillor de Merle on November the 4th asking for a comparison on the mortality rate between COVID-19 and the flu. At the region last week, Councillor Starr spent a while telling an anecdote about grocery shopping to Dr. Lowe, and then Councillor Kovac went out of his way at the region as well to talk about how well places of worship are doing at physical distancing, despite the fact that Dr. Lowe has asked people to attend streamed services and has said they're a serious form of transmission. So, I mean, I hear you're very serious on this. I hear Dr. Lowe is very serious on this. Why is that level of tone not coming from your councillors as well, and does that concern you?
Isaac, I believe that my councillors are deeply committed and very concerned about the spread of the virus, and we're all trying to balance lives with livelihoods. I'm deeply concerned about virus spreading once again into our long-term care facilities, affecting our elderly, people with compromised immune systems. The numbers I gave you were that we have the virus now. We have 11 outbreaks in LTCs, 5 in retirement homes, and 4 in group homes. And we have one long-term care facility, Tyndall Nursing Home, with 90 residents and 60 staff testing positive. So I'm deeply concerned how it's affecting people. On the other hand, I have a very strong pro-business council that are worried about small businesses and entrepreneurs and those individuals in our community who are driving our economy, that we know are not the source of the spread of the virus, that we know have a plan and a protocol in place to prevent the spread of the virus. We know our restaurants have only accounted for about 3% of spread, and gyms 3% of spread, and very few incidents in any places of religious worship. However, so of course my councillors want to protect the right of the businesses to stay open and do it safely. However, we have to balance that with the surge in numbers that we're seeing and doing everything in our power to prevent further spread of the virus. And if that means closing things down for a period of time so we can get this virus back under control so it doesn't take further lives. I understand this was the highest number of deaths in Ontario since the springtime today, a new high, a new low, if the way I look at it. So I think they're deeply concerned, but they're also advocating for the business community and places of religious worship in many cases as well. We all recognize that they're not the source of the spread, and if we can keep them open, we will. But at this point, with our numbers the way they look, our positivity rates, our cases per 100,000, our R factors, it's out of control, and we have to look at taking some really more restrictive measures, shall we say, to get it under control.
Follow-up?
Yes, building on that, I want to ask a little bit about it's resetting that dialogue, right? We went through stage 3 in August and people have clearly drifted. People, I think when you speak to people, they're clinging to the fact that some of Dr. Lowe's recommendations are recommendations and not bylaws. That balance between business and the virus becomes increasingly difficult as the virus spreads. So I'd like to ask both you and Dr. Lowe about a lockdown, not just because some of our cases are coming from unnecessary community transmission, but to really reset the urgency of this in the community's mind by making it absolutely black and white.
Isaac, it's an excellent point. I have to tell you, we know that people became lax in the summer. The weather was nice. They're in COVID fatigue. The weather is about to get grim and cold once again. They'll be indoors and they'll be asked. There'll be more restrictions put upon people, and and there's that fatigue I talked about. So, I think the resetting is important. Resetting of tone and a resetting of restrictions, and just a complete reset in our community. So once again, I have to say that we're now balancing lives against livelihoods. And when you bring it down to those terms, there's only one choice, and that's to do the right thing so that people aren't dying in our community. Dr. Lowe?
So thank you, Madam Mayor, and thank you, Isaac, for the question. Certainly I've said this before. Our conversation has been a privilege to some extent, and we do know that many other countries eventually get to a point where their transmission rates, their case, their hospitalization situation, intensive care situation. I've called it the world's largest open book test, and we've seen where in certain places they haven't necessarily figured it quite all out and how the results fare there. And so to some extent, the conversation we've been having is very much a privilege and a luxury to say, well, could it be this? Could it be that? Where are we going? Could we close or open? And that's why for the last few weeks, my message to our community has been invariably clear. At this point in time, we need to reduce our close contacts. We need to reduce our in-person interactions. Limit your close contact to the people that you live with, and outside your home, limit your interactions to the most essential with precautions. That's basically all it boils down to at this point in time, and that is essentially my contribution to the ongoing conversation. As Mayor Crombie and certainly her councillors, they have the unenviable task of balancing all sorts of different interests in the communities. But even for those members in the communities where there is a lot of insistence, where there is a lot of pushing with our decision makers, I have to say, and I've said this before, our situation right now is materially different from where it was in August and September. And so to the extent that you can be a good partner, whether you're a place of worship, whether you're a business, whether you are, we're all struggling, but where you might be struggling and whether you're vulnerable, knowing that you need some help, I'm asking that there be help given and that we all work together to make sure that we limit our contacts just for the next 2 to 4 weeks to try to get this under control. And I want to just say as well at this point in time, I know Mayor Crombie and I know that Mississauga Council and the rest of Regional Council, I've had certainly the honour and privilege of working with them throughout the last 8 months. It hasn't been easy, and I know that there's a lot of interest and considerations out there, but I think Peel would be far worse off if it were not for their leadership through this point in time. Thanks very much for the question.
Next question comes from Steve Cornwell at Mississauga News. Go ahead, Steve.
Hi, Mayor Crombie. Thank you for the update this week.
Hey, Steve.
Just building off of Isaac's initial question, the past few weeks there has been some critical comments from Mississauga Council about public health and other health authorities, their handling of recent COVID measures and communications. You said yourself many times that individuals have to heed the advice of health officials to get us through this pandemic. But are you concerned at all that the council comments last several weeks may undercut the authority of Dr. Lowe and public health efforts to control the virus?
No, let me say that my council cares deeply. They care deeply about their city and about their residents. And of course, they're balancing the spread of the virus and are trying to be advocates for the business community, the small businesses and the entrepreneurs of our city as well. We know where the source of spread is. It's community transmission, it's household transmission, and in some cases, it's workplace outbreaks. So of course, naturally, they wanted to protect those businesses that were not the source of the spread. But at this point, with our cases out of control, it is more important that we put on more restrictions and do everything we can, everything to follow the guidance of public health to get this virus under control. If I may add as well that I wanted to suggest that we need the residents' support in enforcement measures as well. I'm asking everyone, since it's often difficult to monitor small and large gatherings, particularly if they're at a home, at a private setting, if you see an inordinate number of cars in a driveway on the street, it's very important to call 311. It's very important that we can control these situations, and we do need your assistance. We have issued 23 tickets and fines just this past week, 82 for businesses, 76 for gatherings, and 9 in city parks and facilities. Many of them have been restaurants that were open where they shouldn't have been indoors, or did not or were exceeded capacity, didn't practice safe physical distancing, or were not monitoring for face coverings. So by and large, our bylaw enforcement, whether are proactive, doing a tour of the certain businesses, or reactive to 311 complaints, they are on it. And so we need the assistance of the public, but certainly our bylaw enforcement has been out in full force, and I thank them for the work that they do.
Follow-up?
Thank you. And just a question about the upcoming kind of budget discussions that are happening at the city. We learned today, for example, that skating is one of the many recreation programs the city runs is kind of operating at a bit of a loss in terms of what the cost of opening the ice, for example, versus the revenue that's coming in. I'm sure that's just one example of some of the revenue kind of adjusting and changing in the city. But my question is, with the pandemic kind of basically, controlling what the city can't do insofar as its typical revenue streams. Is there any thought being put into postponing the budget process until there's more clarity about what the pandemic situation has in store for the city?
Well, it's a good question. In fact, I think we're starting the budget process next week. As you know, we've already anticipated what our potential increase might be, and we're looking at the region as well. There's a lot of thought too that the region should go first because they're the larger share. They have a larger weight on the taxpayer. So what we will do is we'll undertake those discussions. We're in the midst of the second wave, so we may see more closings resulting in lower revenue for the city. We're very hopeful that the provincial federal government came forward to support municipalities in the first wave. There is an opening for application for support for the second wave, and there will be that what we're calling an echo effect next year. But it's important that we get the process underway so we know what we're looking at. We will likely not pass our budget until we're finished at the region of Peel. And at the end of the day, we really don't have an obligation to pass and move our budget until close to March. So we do have some flexibility. I personally like to have our budget completed by the end of the year, so I'm starting the year fresh. We're on a calendar fiscal, so I know what money we can raise and spend in that calendar year, but we do have a little bit of time in 2020 2021, then we can revisit. Maybe if we don't move, or if we don't pass the budget in 2020, we can move it to the first few months of 2021. You're quite right. There is some flexibility there because things are evolving and things are changing daily with respect to the COVID numbers.
Your final question comes from Khaled at My Second Home TV. Go ahead, Khaled.
Mayor Crombie, how are you? Actually, as an insider, and you know lots of what's going on behind the scenes, where is Bill C-9? Is stuck, and why?
It's stuck in the Senate, and Khaled, I'm not sure why, and that's why I made the public appeal to get the process moving. I do intend to make some calls to our local Mississauga MPs to determine if they can give me any insight what the holdup is in the Senate, and maybe they can make some calls to anyone they know in the Senate that we can get this bill freed so that small businesses can get the support that they need.
I say, may I ask Dr. Lowe as well?
Certainly.
Thank you.
Go ahead with your question, Khaled.
Dr. Lowe, is there any certain protocol to transport COVID deceased bodies between where they are deceased to where they are being buried or cremated or whatever? And also, if you can expand a little bit on the rapid test, especially the Premier today touched on this a little bit, and he mentioned that he will be receiving something from the federal government.
Yeah, thanks, Khaled. I'll start with the rapid testing. So the provincial government is starting to roll out rapid testing in a pilot at various workplaces, really just to, ascertain the validity and the effectiveness of the test. And so that's something that is coming now as the province rolls that out. And so I know that there are a number of workplaces, number of places in Peel that have been contacted. Certainly hope, once it becomes available more widely, it can be used, for example, to rapidly diagnose in the cases of outbreaks, in the cases of exposures. Those will be certainly a game changer. And then in respect of transportation of remains for people who have unfortunately succumbed to COVID, there are specific regulations if the deceased is to be repatriated overseas. Usually it involves a hermetically sealed casket, certainly if you're interested in this, I encourage you to contact our communications associate. There are specific regulations and specifications that I won't necessarily get into here, and you can also confirm with our counterparts at the Canadian Border Services Agency, because they also receive repatriated remains in a similar manner, and these are international protocols and requirements which our federal counterparts would also be aware of. So thank you very much for the question, Khaled.
That concludes our press conference for today. I thank everyone for joining us, and we'll see you next week.
Thank you.